مرحبا يعطيكم العافية. اليوم رح نحكي على موضوع اللي هو Fixed Orthodontic Appliances. As you know, we have different types of orthodontic appliances. The first one is the removable orthodontic appliance, and I'm sure that we covered that one, I think, last semester. And then we have the functional appliance, and we talked about that the functional appliance use the function to stimulate growth. So basically, they stretch the periodontal ligament and the muscles in the fascia, and that will result in releasing of growth factor and stimulation of growth. But today we're going to talk about the fixed orthodontic appliance and how the fixed orthodontic appliance work. So this is kind of video summarize the different types of or the different components of the fixed orthodontic appliance. So as you can see, we have the bracket, which is bonded to the tooth structure, and it has a mesh that will increase the surface area to be bonded, and then the bracket is attached to a wire that is a flexible arch wire, and then you have a modules that tie the wire into the bracket. That's an elastomeric module, or we have a steel ligature that is tying the wire to the bracket. So we have two types of ligation. A new type of brackets came up recently that has a gate that you can open it and close it. As you can see, it's called self-ligation. On the brackets, usually we have hooks like this, and these hooks are used to attach elastic into it. As you can see, these hooks are used to attach the intermaxillary elastics, as I think you took the lecture about the anchorage, so it's going to join the maxilla and mandible. We have what we call it power chain or elastomeric chain, that bring the teeth together. We have the coil spring. It's made of nitai, and it's just like a zumbrak, so it pushes the teeth away. We have the bands, as you can see, that has a headgear tube, so that can attach the headgear into the appliance, and these are the molar bands. We usually use the bands. It's the same as the bracket, but usually we use it for the posterior teeth because the origin of the brackets actually before bonding, all the teeth were banded. So because the bracket is soldered to the band and it's cemented on the tooth, but because of the aesthetic and the development of bonding techniques, we start to use bonding instead of banding. But now, because of the heavy occlusal force on the posterior teeth, the bonded tubes or the brackets keep coming off, so we start to use bands instead of these tubes. Not in all the cases, but in some of them. So how does the orthodontic appliance work? So basically, we get a case of crowding like this. The brackets are bonded, the wire is inserted, and then it's ligated. Now what's going to happen, there's going to be an interaction between the bracket and the wire that result in a movement of the teeth. So basically what moves the teeth is the wire, because at the beginning of this treatment we will have a flexible wire that will tend to go back to its original shape. And this move, going back to its original shape, it will take the teeth with it and make them an aligned teeth, as you can see. And later on, that's the first stage of treatment, and then the second stage will be the space closure, in which we want to use a rigid arch wire to bring the teeth together. So fixed appliances are able to do kind of complex orthodontic tooth movement. So where it began, this is the guy who first invented fixed orthodontic appliance. His name is Edward Angle. He is kind of described the father of modern orthodontics. So what he did do, he had plenty of trials before he came up with something called Edgewise Appliance. So this is his appliance. It's called Edgewise Appliance. And by the way, when he invented this appliance, he called it the latest and the best, because he believed at that time that this is the best appliance, and he kind of true, because this appliance was invented maybe in the 1930s, and the modification to this appliance took place in the 1970s. So that means it's about 30 or 40 years. So this is the Edgewise Appliance. It has the bracket with a slot, as you can see, and the slot is cut in only one way. All the teeth has the same bracket, so it's not individualized for each tooth. But as you can see, then the result of using these edgewise brackets, that all the teeth at the end will be similar. Similar, I mean, in the angulation, in the inclination, in the in-out position. So the teeth are not nice. So that's why Angle, he invented or introduced what we call it finishing bends, which is the first order bend. I will explain it now. As you can see in the canine in the top upper left canine, the one with the wire to the right of the screen, you can see that the canine is bulbous and it's more protruded compared to the lateral incisors, which when the central incisors are more kind of more labially positioned compared to the lateral. Now when you use an edgewise appliance, because all the teeth have the same bracket, the wire will bring all the teeth together. So the lateral incisor will move until it's in a line with the most prominent part of the canine, which is going to bring it further than the central incisor. And that means the aesthetic and the look of the lateral incisor will not appear natural, and it will not appear nice. So now we're going to use something we call it the first order bend, which is basically the in-out bend to do the finishing. So this bend will move the lateral incisors slightly palatally. The second order bend that we're going to describe is what we call it the tipping. So basically, just to understand the tipping, look at this canine. In the picture in the top, it's distally angulated. Now the canine in the normal population, it has to be mesially angulated. So what we need to do is to move the root distally and the crown mesially. This kind of tooth movement, we call it the second order bend or the tipping movement. So if you look at this canine where we started, and this is how it's finished. Now this is an exaggerated photograph, but even though if the tooth has a normal position kind of at the beginning, like the central incisors, you know that the central incisor has to have a little bit of mesial tip. All the teeth, by the way, has to have a slight degree of a mesial tip, especially the anterior teeth. So now, as you can see, the central incisors are upright, so you need to apply a little bit of mesial tip for them to look nicer. And that's when we do the second order bend. So to understand it even more, you can see this video, it's a slow motion video. You can see that this is a tipping movement. Sorry, this is a second order bend movement in which the root is moving in one direction and the crown is moving in the opposite direction to upright the tooth. This is what we call it second order bend. The third order bend is what we call it the torque. So the torque, basically, you move the root inside the bone with minimal movement of the crown. So if you look at this tooth here, so the wire will engage the bracket, and then what is happening that the crown will stay where it is, and the root is going to move palatally, as you can see in this photograph or in this video. So because that we have a lot of finishing to do, the teeth can't slide. And in order to close the spaces, if we decided to close a space or we extracted a teeth and we want to close, is to do what we call it loop mechanics, which is something like this. And I will explain it to you later how the loop mechanics work. So the wire will look something like this because we have a lot of bends into the arch wire. And later on, Andrews came in the 1970s, and what he did, he incorporated all these bends into the fixed appliance. So let's start with the mesiodistal tip. This is a bracket that is by Edgewise on the right hand side, and this, as you can notice, that the slot of the bracket is perpendicular to the long axis of the bracket. So what Andrews did is said, okay, instead of applying a bend later on, why not to cut this arch slot in an angle with the long axis of the tooth or the bracket, which means that when the wire is placed into the bracket, the tip will be expressed. So now we will have the second order bend without even having to do the wire bending. This one. And then he said, okay, listen, what about the first order bend? As you can see, the thickness of the bracket, of the base of the bracket, which is the distance between the mesh the base of the bracket, and the base of the arch wire slot. Now, the final position of the tooth will be the distance between the arch wire and the base of the bracket. This is the final anterior-posterior position of the tooth. So if I increase the thickness of this, what we call the stem of the bracket, and if I increase the distance between the base of the bracket and the base of the arch wire, that means that the tooth will move more in a palatal position compared to the tooth next to it. So for example, the example that we gave about the canine and the lateral incisor, when we use a canine bracket, we use the stem thickness, for example, of 2 millimeter. Now we want the lateral incisor to move slightly palatal, so the thickness of the bracket of the lateral incisor will be 3 millimeter. That will push it more palatally. So that's what he did exactly. He controlled the thickness of the stem of the bracket, which will control the in-out position of the tooth. And by that, we don't need now to use the first order bend. Finally, then the third order bend, and as you can see that the base of the arch wire or the arch wire slot in the Edgewise appliance is cut perpendicular to the long axis of the crown. So now all the teeth at the end, they will have similar torque. But what Andrews did, he said, okay, instead of that, let's trim this arch wire slot with an angle to the long axis of the tooth, and that will program the torque that we want. For that reason, we don't need a lot of wire bending in the appliance that is invented by Andrews. And for that, he called it the straight wire appliance, because simply you don't have a lot of wire bending. As you can see, we call it now straight wire appliance, or the pre-adjusted edgewise appliance, which means it used the edgewise appliance, but it pre-adjusted. For that reason, because we don't have a lot of bending, now we can slide the teeth easily. They can slide. So we can use what we call it this power chain that will engage all the teeth and then slide them together to close the spaces. Now, if we have a bending wire that has a bend, the teeth will not move because the bend will prevent them. So these are the loop mechanics. This is one example of the loop. It's called T-loop, that is used for space closure when we use the wire bending and the edgewise. So basically, these are two arms. They are close to each other. To activate it, you just push them away from each other and then bend the wire in the back. Now the wire will tend to go back to its original position, so the two arms will close to be close to each other, and the space will close. So if you have a close look at this video here, you can see the T-loop, and the dentist or the orthodontist is holding the arch wire in the back.
The Weingart plier can be used.
What it's going to do is to hold this wire in the back and then move it distally as much as you can and then bend it in. So if you can see that the distance between the two arms now become to increase, and now he's kind of bend the wire in a way that it will not go back to where we started. Now what's going to happen, these two arms are going to try to meet. So what they happen, they're going to bring the posterior teeth forward and the anterior teeth posteriorly until they meet. This is what we call it loop mechanics, and one example of it is the T-loop. And the reason why we used to use these mechanics, because we have a lot of wire bending to do, so we can't slide the teeth. So that was the Edgewise appliance. It was then kind of developed into the pre-adjusted Edgewise appliance, we call it the straight wire appliance. Nowadays, there is a kind of a change in the manufacturing of the bracket. So instead of using modules, they start to use the gate, a metal gate, like this system. It's called self-ligation bracket. So basically, you insert the wire, instead of ligate it, you close the gate. And by that, you allow the teeth to move. This is nothing to worry about. This is part of the video. So what they claim with the Damon system, because I'm sorry about that. So what they claim with the Damon system is because you are using a rubber or elastomeric modules in the conventional bracket, they kind of having a hard time to slide alongside the wire. While in the Damon system or the self-ligation system, because it's all metal, the friction is less, so the bracket will slide easily on the arch wire. This is kind of true in theory, but then a lot of evidence now came up, and group of patients that are treated with the self-ligation and group of patients that were treated with regular and conventional brackets, and it showed that there's no difference between the two types of brackets. You just end up paying a lot of money for no extra benefit. So far we said Edgewise Appliance, pre-adjusted Edgewise Appliance, or what we call it the straight wire appliance. Then we have the self-ligation appliance, and now the fourth type of the orthodontic appliance is the light wire appliance. So what is exactly the light wire appliance? If you can see that we have an extracted premolar and we have an increased overjet. So the light wire, what we usually do, we retract the canine and then we retract the teeth bodily. This is how we work with the pre-adjusted Edgewise appliance. But the light wire appliance, they do it in a different way. What they do is they tip the teeth first. As you can see, the crown is moving palatally while the root is moving lingually. And then you apply the teeth to their final position. And the reason why they invented this appliance and it works this way, it's because of the anchorage. How is that? So you see here the amount of the space is 7 millimeter of the extracted 4. As you can see that there is no 4. So what we want to do is to retract the incisors posteriorly to close this, or to close the space and reduce the overjet. Now we are in a critical situation in which we need all the space of the extraction because of the increased overjet. So if we lose anchorage by the posterior teeth moving forward, we will not get our results. Torque movement, or like moving the teeth bodily like this, like this, will mean that it's a lot to ask for the posterior teeth not to move. Or we call it anchorage demanding. So retracting the canine bodily might result in moving of the posterior teeth forward because it's a big tooth. So to do less harm, or like to keep the anchorage, these appliances work by tipping the teeth posteriorly first, as you can see, guarantee that we reduce the overjet, then they apply the canine, the roots. The first appliance to work with this philosophy was the big appliance, and as you can see that the slot is vertical, it's not horizontal. So you bring the wire in the top of the bracket and you slot it down, and then you cover the entrance so that the wire will not come up. And as you can see, it's round, the wire is round, and the bracket is round. There's nothing rectangular, there's nothing to control the torque. So these appliances will have tipping first, then the roots will be applied. Now, a new modification of this light wire appliance is called the tip edge appliance, and this is the most recent one of all these light wire appliances. So if you look at the right side, if this is an angle bracket, the Edgewise appliance. So what the guy who invented the tip edge did is that he took two triangles on the left side, the top left and the bottom right. And why is that? Because when he did that, as you can see, that the teeth are free to tip. They're going to rotate until they reach the bracket. So that's what we call it controlled tipping. So we control it because they're going to tip until they meet with the bracket, and then they're going to stop. So what's going to happen when we started, as you can see in the top photograph, we have now a contact in the top left corner and lower right corner with the arch wire. Now the tooth will be uprighted until the distal gingival part of the bracket is touching the wire with the meso occlusal part touching the tooth, the arch wire. And now we have a full engagement with a rectangular size slot, and the torque can be expressed. So this is how the Edgewise appliance works. Tipping movement, then uprightening. Tipping, then uprightening. And this tipping movement is less anchorage demand. That's why this appliance is suggested. Now, for the people who works, you can see most of our patients are kids, so they are fine with having metal braces. However, sometimes you get some people who work in a company, he's a director of a company, and something that is less obvious. For that, we have the ceramic brackets, and I'm sure that this topic was covered in the theory lecture. So these are kind of mono or polycrystalline aluminum oxide brackets that are translucent in color, so the patient will not or at least it will appear less when he looks at himself in the mirror. The last type of the orthodontic appliances is the lingual appliance. So it's again to solve the same problem as with the fixed appliance, the appearance. So the patient doesn't like to look like having a brace, especially the elderly patient. So that we use sometimes a lingual orthodontic appliance. As you can see, it's made of gold because it's ductile. You can قابلية الطرق والسحب. You can shape it to the lingual surface in a thin section and then bond it, as you can see. So these are the main types of the orthodontic appliance: edgewise appliance, pre-adjusted edgewise, then self-ligation, then light wire appliance, and the last one is the lingual appliance. The other type of or component of the fixed appliance is separators. As you can see now, we want to place bands. Now the band has to go through the contact point, and if we don't create enough space for the contact point for the band to be seated, we will not be able to seat it correctly. As you can see now, the separators created space on both sides to allow the band to come down and sit in the place. So that was the last component of the fixed appliance. So what are the stages of the fixed orthodontic appliance? First stage of treatment is alignment and leveling. What do we mean by alignment and leveling? Alignment basically to make the teeth in one line, in alignment position. No protruded teeth, no intrusive teeth, no crowding. All the teeth are well aligned. We could have an increased overbite or increased overjet because in the alignment stage, we only care about the crowded, rotated teeth. So this is the stage number 1. And in this stage, all we need is a flexible arch wire. And this type of flexible arch wire is the nickel titanium arch wire. Then we move to the second stage, which basically is space closure space, in which you can close the residual spaces that we have. Sorry about that. So we can close the residual spaces that we have. So if you have extracted 6s, you have to retract the teeth. You can do it on the working arch wire, which is 1925 stainless steel arch wire, which we use after we finish alignment, in which to do a space closure, and that one will be a rigid arch wire to be able to move the teeth on this wire. So leveling and alignment is the first stage. Then what we call it the overbite control. So if we have an increased overbite, then we will have to reduce it, make it a reduced overbite in order to be able to retract the upper incisors and reduce the overjet, which is our third stage, which is overjet reduction and space closure. So by the way, overjet reduction, space closure, and overbite reduction requires rigid arch wire. And the most common rigid arch wire is the stainless steel arch wire. So we use stainless steel arch wire instead of using night-high in the space closure stage. And then we move to the last stage, which is finishing. So what's happening in finishing, for example, if you place a bracket at the beginning and this bracket is not in the right position, so what you need to do is to take it off and to place a new bracket. That's what we call it finishing. What we can do as well is something we call a settling of the occlusion. So basically, after we finish orthodontic treatment, you place the teeth in their correct position, but the patient does not have a proper intercuspation. So how we can help him using something we call it finishing or settling elastics. So you get the elastics and you ask the patient to wear it in a way similar to one shown in this photograph. And that's guarantee settling of the occlusion. I hope you enjoyed this lecture. For any questions, please contact me. The resource for this lecture is Laura Mitchell textbook. Thank you. يعطيك العافية.